And welcome back. Well, sometimes asking questions is a really good thing, especially when it comes to your health and insurance. So today, how to take more control over your care and why it might even save you money. It is time for a little Insurance 101 with Sovereign Select. Here to school us, Tom Qualley. He's the CEO of Sovereign Select, and he's here with ways to be more proactive with your health coverage. Great to see you, Tom.
Nice to have me, or thanks for having me on.
Sort of the bottom line here is you got to be involved. You got to think that you're part of the process. You got to ask questions. You got to take a look at things, and it's great to have some help, but you got to take charge.
Proactive is the name of the game. You know, it's kind of like you can do all the research in the world, or you can just make a quick phone call, which really, you know, we do the research all the time, and we're an independent insurance agency, so we specialize, you know, in the Medicare plans, individual health insurance, and, you know, you give us a call and we've already done all the research, and what we're going to do is we're big on education, so we're just going to walk people through the steps and educate them exactly on exactly what they're looking for and show them all the options that are available to them.
And the bottom line is it's smart to be proactive because it could save you a whole lot of money. You've been on this show for years and saving people, in some cases, hundreds of dollars.
Yeah, almost,
a month.
Almost 6 years, I think.
Yeah.
Time flies when you're having fun.
Right?
But yeah, the average person that calls in, you know, specific to Medicare supplement plans, they do go up every year, every single year. You know, our clients know that they're going to get a birthday card from us and a rate increase from the insurance company.
Right.
So when they get those rate increases, or even beforehand, they should just give us a call and say, hey, this is what I'm paying now, and what can you offer?
And with the supplements in particular is where you save people money.
Yeah, and what's nice is you can actually change those plans any time of the year. There's no enrollment periods for Medicare supplements, so they could call today, tomorrow, next week, doesn't matter. They can change their Medicare supplement at any time, and the average person saves about $600 a year.
That's amazing.
Yeah,
it's wonderful.
We've had some pretty fun scenarios where we've saved people a few $1,000s a year. So
even better.
Yeah.
And I bet that
so
feels really...
somebody might win the lottery if they call. You know?
Right? See, it's big savings potentially. A lot of people turning 65 each month.
Correct.
So people who are new to Medicare should do what?
Get educated. So education is the key when you're going on to Medicare. I have so many people that come through our office every month or every year that just say, you know, God, I've been trying to research this, and I've been reading the books, and I've read the government materials, and I've gone online, and they come in more confused than when they started. And then, okay, let me break this down for you. And what we do is we're going to sit down with them. We have group meetings that we'll go over in a little bit, and then we also do one-on-ones, you know, in our office or in their home. We travel as well. And we really sit down with them and actually just educate them step by step on exactly what Medicare is, what the different parts are, what they mean, how they work together, and how they work specific to each person.
Well, and you've talked a little bit about enrollment periods. A lot of people know that the open enrollment period for the Affordable Care Act, which is also difficult to understand, is over, but people can still enroll in the health plan if they qualify for what you call a special enrollment period. So how does somebody qualify for that, or what changes might happen in their life?
Well, if they're in between jobs, or if they you know, lost their job, quit their job, starting a new job, or they're just in between again. Marriage, birth of a child, divorce, changes in income can actually change. Just life changes in general, a lot of times are special enrollment periods. So if there are specific life changes, moving to a different location, things like that can be a special enrollment period, which would allow a person to enroll in a new plan.
So it can't hurt to act. I would think this is a slower time because the open enrollment periods, those windows, so to speak, are sort of closed for now, but it's still a good time to get the information and be prepared to act because some of those open periods are coming up.
Yeah, we can take our time a little bit more this time of year.
Yeah.
During the open enrollment periods, it's, you know, just a little bit quicker. But now, you know, there's special circumstances that we deal with kind of on a regular basis. So if, you know, if a person's not sure, they definitely should just pick up the phone call or the phone and make a call.
You have these meetings every Friday at 10 a.m. at your office where people can just reserve a spot. It's absolutely free to use your services too, but people can come and get educated, as you say, and take that step toward being more proactive.
Yeah, forget about reading all the government materials and going online and trying to research it yourself. There's so much information out there and probably too much to grab and, you know, narrow down. Just come to the meeting, every Friday, or not every Friday, but pick a meeting and get educated there. We break it down in a very simple format and show you exactly what you need to know.
And everybody's plan is different. I know you specialize in tailoring it for a person's need and whatever their health situation is.
Yeah, we have over 30 different insurance companies and have access to hundreds, really. So being able to really tailor it to each person's specific needs is important.
Absolutely. So those meetings are every Friday at 10 a.m. They're in Brookfield. They're absolutely free. They're educational meetings, and you can attend any one. Just call to reserve your seat. The phone number to call is 262-641-4111. Again, it's an educational meeting, not discussing necessarily specific insurance companies or plan details, just a chance for you to learn more. Again, it's a no-cost consultation. Tom will also come to you, to your house, to visit with you. So you can call when it's convenient for you. Again, 262-641-4111 or sovereignselectins.com. Always great to see you, Tom. Thanks so much.